Hello, my name is Catherine Bush, and I am the School Psychology Consultant on the Student Services Prevention and Wellness Team at the Wisconsin Department of Public Instruction, also known as DPI. It is my pleasure to offer this introductory presentation at DPI's Literacy Unconference 2014, Balanced Literacy Assessment for Early Learning. The purpose of this presentation is to introduce curriculum-based measures, also known as CBMs, and their uses in literacy education. This presentation will focus on measures of reading aloud, commonly known as CBM Reading. CBM Reading was once called Oral Reading Fluency. Although there are CBMs related to reading comprehension, early literacy, and writing, this presentation was meant to be a short introduction for people who may not have been exposed to this assessment tool. While CBMs have an aura of simplicity, they are actually psychometrically complicated. To gather information from them, they have to be constructed well and implemented correctly. On the upside, when something is complicated, it often means there is something special about that assessment. When implemented correctly and frequently, CBMs can measure growth. That is a rare quality in an assessment tool. Many promoters of assessments imply that they measure growth, but more often than not, they do not. Not really. Before we get started, let me say this is not a tests and measurements course. I will not be explaining all the different methods of assessment, including the newly popular, such as computer adaptive tests. The focus of this presentation is curriculum-based measures and a little bit about why they aren't as simple as they look. Education has changed. At one time, universal education meant all children had at least some theoretical access to school. They were not guaranteed an education. When I was a child, buses drove past the houses of children with disabilities, and children of color were educated in separate schools. Now, Wisconsin has set its sights on every child a graduate, college, or career ready. This means we are focused on preventing learning problems and intervening early when we see them. In our classrooms, our schools, districts, and our state, we have begun asking the critical question, how do we get children the help they need when they need it? No matter what position we have this as a shared or mutual interest. In the last decades, the concept of multi-level systems of support, also known as MLSS, has been gaining in popularity. We are mutually interested in designing our continuum of services to prevent learning struggles to begin with, to intervene early so children don't drop behind, and to identify and understand the problems of the few children whose struggles with learning are so severe that significant additional resources will be needed to help such students find success in learning. These many purposes for our multi-level system of support means we have different purposes for our assessments. The purpose of assessment helps you identify the assessment tool to select. I have chosen these three purposes of assessment because they seem to be important currently in Wisconsin schools. However, these are not the only purposes of assessment. For example, another widely discussed assessment purpose is accountability. We'll not be discussing accountability assessments in this presentation. This three-purpose structure is not the only way to represent different purposes of assessment. You may be familiar with DPI's balanced assessment model. Important to all teachers is the purpose of informing instruction. Assessments that inform instruction tend to be oriented toward prevention of literacy struggles and planning for additional supports early for students who need it. The operative question of the assessments tend to be, does this student know this or not? Teacher expertise is especially critical when assessing for this purpose, as it is essential that teachers know their curriculum and how to assess whether the student has mastered it. This purpose requires the routine collection of instructionally relevant data, in order to provide the information a teacher and student needs to determine what's next. Mastery measurements are frequently used for this purpose. We'll talk a little more about mastery measurements in a minute. When the purpose of the assessment is to inform instruction, technical adequacy is not the most critical element. Of course, we want efficient and effective assessments, but we want them to be useful. Peter Johnston, a well-respected literacy expert, has argued in an ideal world of assessment to inform instruction, every child we assessed would be predicted to have difficulty prior to instruction, and every child would become successful due to subsequent instruction or intervention. Although we know that this never really happens, it helps us understand why assessments which inform instruction don't require the same technical adequacy, such as predictive validity, as assessments for other purposes. Let's turn to assessment for resource planning. Schools or districts may have data-based decision-making teams to help decide how and where to put resources to maximize prevention and successful early intervention while minimizing costs. Examples of how this kind of data might be used include helping create balanced classrooms, deciding what support personnel can be deployed to classrooms during literacy instruction, and at what times. Broad groupings of student risk status to determine at first wash which students are likely to be successful in the universal curriculum, which students should be exposed to both the universal curriculum plus additional interventions, sometimes called Tier 2, and which students are high priorities for further assessment. This resource planning assessment is usually a single data point taken early in the fall or late in the spring prior to give a broad brush picture of needs, so prevention and early identification activities can begin immediately. Since this is typically a single data point, it is helpful if the assessment tool has some reliability, validity, and diagnostic accuracy statistics to help us be more confident that we are not making too many first decision mistakes. A system that uses resource planning assessment needs to be flexible, so changes can be made easily once a child's learning needs are better understood. The types of assessments chosen for resource planning typically include computer adaptive tests, curriculum-based measures, and sometimes even diagnostic achievement tests. Time and personnel are important considerations when choosing these assessments because time assessing is time away from teaching. Sometimes an assessment that is used for resource planning can also be used to measure academic gains over time, a pre-post test, for example. Whether the student has gained skills and knowledge during the intervening time can be determined. For reasons beyond the scope of this presentation, these scores are gain scores, not truly growth scores. Sometimes this gain is called a student growth percentile. A third purpose of assessment is to identify students who are struggling significantly with acquisition of academic skills. Depending on how far behind their peers they are, it may be imperative to get such students intensive support as soon as possible. We want to use assessment tools that can give us information efficiently while giving us data in which we can have confidence when we make decisions about the need for intensive interventions. Resources and time away from the classroom are important considerations, so we want to use assessment tools that are technically adequate and relatively brief to administer. If the student has a substantial performance gap compared with peers, we will want to keep a close eye on growth in that academic area. Can CBMs be used for each of these purposes? Yes, of course they can. Wisconsin school districts have a choice about many of the assessment tools they may use. Some schools use different assessment tools for different purposes, or one tool for several purposes. For example, PALS pre-K through second grade may be used to inform instruction and for resource planning. Smarter Balanced, which will become available in the coming years, will be an accountability assessment, but may be used for resource planning as well. CBMs can be used for each of these purposes: informing instruction, resource planning, identification. While CBMs can be used to inform instruction, they are not usually used for that purpose in Wisconsin. If this were Pennsylvania or Iowa, where there has been extensive professional development and educators have been doing this for longer, we too might have the expertise to use CBMs to inform instruction. For now, we have a wealth of tools we can use for instructional planning. CBMs can also be used for resource planning. There are other tools that can be used for this purpose as well. Can this purpose be met through an assessment tool that takes less time away from instruction? Do we need an assessment tool that can be implemented with integrity without frequent teacher training and retraining? Do we have the bandwidth at our school to administer a computer adaptive test? Do we need to go low-tech? These are questions that can help us select the right assessment tool for resource planning. The purpose for which CBMs stand out is the identification of students who are seriously struggling with learning and whose growth needs to be monitored frequently. CBMs, when implemented correctly, measure growth, not gains, in short periods of time, unlike any other assessment. CBM is one type of curriculum-based assessment. There are two types of curriculum-based assessment, or CBAs: mastery measurement and curriculum-based measurement. Now, some specialists in literacy response to intervention would argue that general outcome measures are not strictly speaking curriculum-based. Those specialists may or may not be right. However, if we only use mastery measures, we would not be able to measure growth. So let's walk through a comparison of mastery measurement and a particular kind of CBM called a general outcome measure. With mastery measurement, we can measure gain. How much has this child gained? How much knowledge has this child gained? Curriculum tends to be broken down into specific sub-skills or short-term instructional objectives. The assessment is an assessment of a specific skill that's being taught. For example, R-controlled vowels in reading, or single-digit addition without regrouping. Skills usually assessed are usually teacher-made or publisher-made. There is something called measurement shift. We'll talk a little more about this in a minute. And mastery measures are very reliant on teacher expertise. Another kind of curriculum-based assessment is a CBM general outcome measure. Now, this kind of measure can measure growth. It looks at general domains, not subskills. So it keeps the global curriculum outcomes intact, and it uses long-term goals. We can answer questions such as, where would we expect students to be reading by the end of the year? It makes no assumption about instructional hierarchy. There is no measurement shift, and it is highly reliant on technical adequacy. So let's ask ourselves the question, what is measurement shift? In mastery measurement, measurement shift occurs. For example, we might teach and assess single-digit addition without regrouping before teaching single-digit addition with regrouping. Or we might teach vowel sounds before teaching R-controlled vowel sounds. This measurement shift makes it difficult to monitor overall progress because different skills are being measured at different points in time, and different skills are not of equal difficulty and do not represent equal curriculum units. When a general outcome measure in reading, such as CBM Reading, there is no measurement shift. This quality, along with the technical adequacy of the instrument, allows us to answer a unique question. How well is this student growing in overall reading performance compared with his or her peers? So most forms of classroom assessment, classroom-based assessments, are mastery measurement. CBM reading is not a mastery measurement. It is a general outcome measure. So we're going to look at a few more contrasts. With mastery measurement, we're talking about skill hierarchies. With a CBM general outcome measure, if you're interested in specific skills to teach, a general outcome measure is not the most appropriate assessment tool to use. Use a diagnostic assessment instead, or a mastery measurement. Mastery measurement is usually not standardized. Reliability and validity are rarely known, whereas a CBM general outcome measure, standardized procedures with reliability and validity that can be determined. Under mastery measurement, we don't look generally at retention or generalization of skills, except as it relates to semester tests, for example. In CBM general outcome measures, we tend to incorporate automatic tests of retention and generalization. Mastery measure is a measure of short-term goals, whereas CBM general outcome measure is of long-term goals. And with mastery measurement, implementation integrity is secondary. It's not that it isn't important, but if you do it differently in April than you did it in October, it's probably going to be okay. Whereas implementation integrity in CBM general outcome measurement is essential. So which type of CBAs do teachers know best? Well, mastery measurement looks like curriculum. It has good, what we call, face validity. It seems authentic. It seems just like a part of what we do. This is how we teach. We check to see whether or not our students are learning it. What about a general outcome measure? For reading, I hear people say, seems like we're trying to teach children to read faster. It doesn't seem authentic. And it seems like an add-on. This is something new I'm expected to do. And what are the objections that people have to CBMs? Well, they seem too simplistic for the complex task of reading, written expression, and math reasoning. I understand that they can be offensive when mastery measures are criticized for lack of reliability and validity. It can be offensive when it's implied that universal screening does a better job of identifying students at risk than teacher recommendations. The standardization, the fidelity, the implementation integrity, and scheduling for progress monitoring using CBMs can be frustrating. And there are more objections. So why would we use them? First of all, just know that CBMs have a substantial amount of research based on them. And why would we use them? Well, there are three main reasons that have been supported by research. One is that teachers who use CBM make more frequent instructional changes, which result in better student performance. Also, CBMs provide immediate feedback for the teacher and the student, which also results in better student performance. We know that immediate feedback is important. And three, CBMs can be used to make screening and progress decisions about individuals, classrooms, grade levels, without having to collect additional information using different assessments. It's not only valid and reliable, feasible, but CBMs are sensitive to student growth. There are three types of curriculum-based measures. The first is a sub-skill indicator. It requires a task that is a specific skill that is expected to be mastered within a relatively short period of time. I'll give you an example shortly. A multi-skill indicator is a task that can be developed by including a few items of each specific skill that should be mastered within a period of time, such as during first semester or during a school year. Then we have general indicators, or a general outcome measure. It's a single capstone task indicating general performance in a content area, for example, reading aloud. So the example of a general indicator is fluent oral reading of connected text, which is a task that requires sufficient knowledge and application of foundational reading skills, such as phonological awareness and phonics, as well as activation of prior knowledge and understanding of the content. Therefore, CBM Reading serves as a general indicator for reading. The same task is used at multiple grade levels, but with different complexity of text and with different standards for proficiency. General indicators can be used for both screening, because of the broad content areas, and for monitoring progress, toward which student progress can be compared and measured repeatedly. This is an example of a subskill indicator. This subskill indicator is for addition facts up to 5. So why does this matter? Because there is a measurement shift in this type of CBM, and therefore not a good indicator of growth over time. So it's important to know that even CBMs, along with mastery measures, have some measurement shift. Now this is an example of a multi-skill indicator. It's a mixed math computation probe which contains problems representing the various operations within a specific math standard. Each item represents a specific operation, and all the skills expected to be mastered within the time period should be represented on the probe. This is an example of a general indicator in reading. On the left is the probe given to students. On the right is the examiner's score sheet. It has the same text and the cumulative number of words in the passage for each line. The student is given instructions. The examiner begins the timer and marks errors as the child reads. At 1 minute, the examiner marks the last word read. The student may complete the passage or be told to stop after 1 minute at the examiner's discretion. There are a large number of probes at each grade level that have been very carefully equated to minimize error. We'll talk more about that later. Is CBM reading a measure of reading? Not exactly. It's an indicator of overall reading health. When we measure a child's temperature, we're not looking for the appropriate treatment. When we find an elevated temperature, we don't treat it by putting ice in the baby's ear. We know that this elevated temperature is an indicator that there is a health challenge. Something is not right. The elevated temperature tells us we need to look further to discover what health challenge the baby might be experiencing, which may help us discover the appropriate treatment. Like temperature, CBM reading can be used to indicate overall reading health. If there is a gap in CBM reading scores between the student and peers, the solution is not to teach the child to read faster. It is to find the right solution to that child's reading challenge. Just as a baby's temperature going down over time indicates improvement in the baby's health, so a CBM reading score going up over time means improved reading health and closing the reading gap. So, my answer to the question is, do you want me to teach children to read faster? Absolutely not. So, we're going to turn more specifically to why curriculum-based measures are so challenging in terms of their technicality. Measurement of growth, not mastery, not gain, measurement of growth turns out to be a very tricky business. So just as listening to a child's reading looks deceptively simple, it is a highly skilled diagnostic process requiring teacher expertise. Just so, measurement of growth in literacy looks like a simple reading task, yet it is a highly technical assessment that is one of the very few ways to measure growth. When we're measuring growth for a student referred for special education in specific learning disabilities, we are required to use a probe. This definition of a probe is complicated. While a number of measures typically say they measure growth, very few meet the requirements of this definition. CBMs generally meet this definition, but not all, so be careful. A probe is brief. Schools must decide what they mean by brief. 45 minutes, 30 minutes, 15, 8, 1. This is important because probes must be administered every week in a special education evaluation. A probe is direct, which means it's low inference. Well, what does that mean? Low inference means you can tell whether the answer is correct or incorrect on a real educational task. So let's look at this task that I would call a high inference task. Is it a bat? A fox? Two angels arguing? Two witches hanging on the sides of a motorcycle? How would we even know whether any of these was the correct answer? And what real task is it measuring anyway? However, 2 plus 2 equals 5 is low inference. It is knowable whether this math calculation is correct or incorrect. There are multiple equal or nearly equal forms in an assessment to be a probe. Now this looks deceptively simple. This sounds a little like what we do when we level books in our book room at school. This is important educational work and allows us to provide practice at the child's instructional level. On the other hand, equating assessment forms is a highly technical task. For example, equating reading passages sufficiently to give us high enough reliability for a high-stakes decision is a seriously technical and formulaic process. In a CBM, equating is quite different from leveling and is done only by educational assessment specialists. A probe is sensitive to small changes in short periods of time. This is the quality that is the most difficult for other assessment tools to achieve. For example, for eligibility decisions in specific learning disabilities, we need to measure weekly and be able to gather sufficient data to make an eligibility decision within a reasonable duration for a special education evaluation timeline. And a probe must be reliable and valid. There are many types of reliability and validity. CBMs tend to perform well on these statistical properties. However, if not implemented with integrity, reliability and validity can be compromised, just like any assessment where technical adequacy is important. So what does CBM data really look like? Here's a simplified chart representing one student in one semester receiving an intervention in general education. If this is a CBM reading probe, it is important to understand this is not a measure of how many words this student knows and can read. Instead, in the first week of school, the student read 40 words correctly in 1 minute and 60 words correctly in 1 minute in week 8. This does not mean the child knows 20 more words in week 8 than in week 1. It means the child reads connected text more efficiently and effectively in week 8 than in week 1. We also don't know if the difference is growth. 2 data points are not enough. Now in this example, the first week of school, the student was administered a single probe with a score of 40. Near the end of the first quarter, weekly probes were begun. Notice that in this case, probe data was not charted for several weeks. When we examine this chart, it seems like the student is improving. What can help us be more confident in this analysis? In this chart, the same data appears. We add a trend line using a statistical method, and the trend line tells us that this student is indeed improving. We also have the line that tells us how well peers perform on this task from the beginning to the end of the semester. We can see peers start the semester doing much better than our student. We can also see that our student is growing faster than peers. At this rate, we can expect this student to catch up to the growth shown by peers during second semester. Great news! Now we have to face one of the serious problems in assessment. This problem is nearly as important as how much time we take out of instruction to do assessment. All measurement includes error. And just look at these different methods for taking temperature. We know that precise measurement depends on the method you use and the quality of the measurement tool. If we want to make the decision about whether to take our child to the doctor, probably any of these methods will be sufficient. However, if the decision is about a high-stakes decision, like emergency surgery, the physician will want an accurate reading of temperature over time. A spiking temperature is important to the doctor's decision, and he or she will want to be confident in the measurement tool used. It's the same with CBMs. Measurement includes both growth and error. Unfortunately, with CBMs, sometimes the error found can be the same size as the growth demonstrated. So what are we looking for? We want more growth and less error. So for all decisions, but especially for high-stakes decisions, such as special education eligibility in specific learning disabilities, we want to maximize the growth and we want to minimize the error. So what do we do? Well, first, don't despair. There are things we can do. Like what? We can pick a CBM with the best statistical properties to assure technical adequacy. We can control potential sources of error. We can compare the data from different sources to make sure all the data are telling the same story. We call that triangulating the data. So, looking more closely on assuring technical adequacy, there are a number of things to look for. We want diagnostic accuracy. We want validity, reliability. We want small confidence intervals. We want to use very good or good data sets, which are very well equated. So these are some of the examples of important statistics to help assure technical adequacy. We want to control potential sources of error. We do that by assuring integrity of administration. We want to collect sufficient data for decision making. We want to pay attention to issues of sensitivity and use multiple sources of data for decision making. For example, since the task of listening to a child read aloud for 1 minute seems so simple on the surface, some people might be tempted to tweak the administration just a little. However, standard administration of a probe is essential to reducing error and maximizes the chances of reliable and valid data for decision making. We can triangulate the data. We can ask ourselves some questions. What other data sources do we have to bring to the table? Do all the sources of data tell the same story? If not, do we know why? For high-stakes decisions especially, are we confident in our data? If not, do we have the willingness to make the appropriate decision? How will we use the data to help us make the best decision for our students? CBMs look simple, but they're not. They're designed to help make database decisions about how much growth a child is making. In literacy, it helps answer the question, how much has this child's overall reading health improved during this short period of time? We'll want to collaborate with a data analyst to learn how to understand, administer, and analyze CBM data. Multi-level systems of support and response to intervention are both initiatives that require greater collaboration than we've needed before in public education. Just remember, as you move forward in selecting and using assessments, all educators, regardless of our training, role in the school, or expertise, have a mutual interest, getting kids the help they need when they need it. I appreciate this opportunity to discuss curriculum-based measures as part of DPI's Literacy Unconference 2014 Balanced Literacy Assessment for Early Learning. Thank you very much for your time. Please feel free to contact me or other DPI educational consultants with concerns, questions, or curiosities about using curriculum-based measures in educational decision-making. Thank you.